Welcome. My name is Kashif Ali. I am an orthopedic surgeon here at Edgerton Hospital, and welcome to today's talk. Today we're going to be talking a little bit about common sports injuries. The talk today is kind of geared more towards adolescent injuries and more younger folks who are involved in athletic activities and some of the common injuries that they can sometimes experience, some of the prevention strategies, and also some of the treatment options that we use for them. So hopefully you find this talk interesting and useful. So to start out, just a little bit about me. I went to college at the University of Michigan. I grew up actually just outside of Ann Arbor, Michigan. Went to med school in Cleveland at Case Western Reserve University. I then went on to do a 5-year orthopedic surgery residency at the University of Chicago. I went on to do an additional year of subspecialty certification and fellowship training at the Aspen Sports Medicine Foundation in Colorado, where I worked with skiers, athletes from the X Games, and also a lot of the high school sports there, and a lot of the athletes in Aspen. Prior to coming to Edgerton Hospital, I worked in Janesville, Wisconsin, for the past 8 or 9 years, since October of 2014. And now, more recently, am part of a group called the Orthopedic and Spine Centers of Wisconsin, which serves patients in the southern region of Wisconsin, as well as the greater Dane County area and surrounding areas from Madison up north. So a little bit about my practice and what it entails. My practice consists of arthroscopic, which is basically minimally invasive surgery of the shoulder and the knee. So the types of injuries that I treat are ACL tears. ACL stands for the anterior cruciate ligament, which is a fairly common sports-related injury. I also deal with rotator cuff tears, unstable shoulders. We can do these surgeries through small incisions and a camera. We also perform shoulder replacements. So sports medicine, it entails treating patients all along the age spectrum. So young patients who are involved in aggressive athletic activities, as well as older patients who continue to want to be active as they age with arthritic and worn out joints. So we perform shoulder replacements as well as robotic assisted hip and knee replacements, and that's what this picture is here. It's a picture of our Mako robot that we use to perform our hip and knee replacements. So the agenda today, first we'll talk a little bit about the epidemiology of adolescent sports injuries. We'll review some of the more common injuries that adolescents and children can experience as they're participating in these sports. We'll talk about treatment options, and then along the way we'll also talk a little bit about some prevention strategies on how we can kind of prevent these injuries. And some of these things can also apply not only to adolescents, but also to adults at the same time, so not only kids. So, pediatric sports injuries. In the United States, over 25 to 30 million children and adolescents take part in school sports activities, and 20 million are members of sports clubs. So the amount of kids and adolescents participating in sports is always growing, and acute and overuse injuries are always increasing. One of the most common causes for injuries and visits to the ED for adolescents is actually sports injuries. 3 million patients are seen in the emergency department for sports-related injuries every year, and about 5 million are seen in primary care or sports medicine clinics every year. So sports injuries in our younger patient population is becoming more common as more kids are participating at a younger age in these sports. As far as the rate of injury go, the highest rate of injury per hour of participation in terms of which sports cause the most types of injuries, when you break it down between boys and girls. In boys, ice hockey, rugby, football, and soccer are the ones that cause the most injuries. In girls, it's usually soccer, basketball, and gymnastics. So when we're talking about pediatric sports injuries, there's a correlation between the rate of injury as well as the age. So as patients get older, they often get a little bit heavier, a little bit faster, a little bit stronger, and sometimes that agility and that strength can outpace how fast their bones and their bodies are keeping up with them. So what we've always told people is, adolescents and kids are not just small adults, they're actually their own kind of subset of population, because their bones are different, their ligaments, their tendons are different, and their bodies react in a different way than an adult's would. So pediatric sports injuries are pretty common in gymnastics due to the longer training hours that patients experience in gymnastics, as well as the complexity of the performance as patients age. So all that impact activity with floor exercises and floor routines, with the bars, all that stuff goes into making gymnastics fairly common in regards to pediatric sports injuries. There's also this imbalance between strength and flexibility as patients grow. So this chart in the top right here shows a growth curve for both girls and boys. The girls is this one which peaks a little bit earlier, and then this boys that peaks a little bit later. And this PHV is something called the peak height velocity. That means it's the rate at which kids grow in terms of their truncal height as well as their bony development in terms of gaining actual height. And sometimes as patients go through this growth spurt, as their bones get longer and as their trunk gets longer, sometimes the muscles and the tendons don't catch up to them, and so that leads to tight muscles. It leads to abnormal movement mechanics as they're participating in sports. So oftentimes what you'll see is that patients, adolescent patients in particular, as they're going through this peak height velocity or this incredible growth spurt, they can sometimes be at a more higher risk for developing certain types of sports injuries, just because their muscles and their body is just trying to catch up with the bony development as they age and are getting bigger. So one thing to know is that pediatric bones are different than adult bones. They're more porous, they're a little bit softer. They also have growth plates. Growth plates are basically areas where the bone is elongating on either side of the bone. This is an x-ray of an adolescent child from the femur, the hip at the top, down to the ankle at the bottom. As you can see here, these black lines at the top of the shin bone and at the end of the femur bone, those are not broken bones or fractures. Those are actually growth plates. And sometimes these growth plates are an area of weakness within the bone. That bone is a little bit weaker than the surrounding bone. And so patients can actually break the bone through that growth plate, which can actually cause problems down the line and damage the growth of that extremity. So that's how pediatric patients are a little bit different. We talked a little bit about the muscle and flexibility imbalance as kids get older, as they grow taller and longer. The decreasing age of participation in sports. Kids are participating in fairly significant aggressive sports at a younger age now, and that younger age is putting these kids at higher rates of injury as they start participating in the sports at an earlier time than they otherwise would have. Sports specialization also can lead to overuse. When kids are, it's kind of anti-intuitive. If you want to specialize in something, if you want to be good at something, you want to do it repetitively over time. But as kids are participating in one single sport over many, many years, sometimes that single sport dominance can actually lead to overuse injuries because they're using their bodies only in one single way during these times of growth. And so that leads to chronic overuse injuries at the shoulder and as well as at the knee. Poor technique certainly can be a cause or a risk factor for adolescent injuries. And then training schedules. Training schedules can be fairly intense nowadays. Kids are more involved in year-round training with sports activities and sports clubs and leagues. So not only are they training during the school year, but they're also training all throughout the summer in the same sport, putting them at a higher risk for developing certain types of injuries. So what are some of the common sports injuries? So this is just a list of some of the things that we'll kind of touch upon today. I kind of distributed them between two groups. One is the acute injuries, meaning things that happen abruptly all of a sudden, and then overuse injuries. Overuse injuries meaning injuries that can happen over a period of time with repetitively doing a certain activity. In the acute injuries section, we'll talk a little bit about the common sprains and strains and the most common locations for those to occur at. We'll talk a little bit about broken bones. We talked a little bit about how kids' bones are a little bit different than adult bones. We'll talk about ligament tears. Ligaments are what connect bone to bone. And we'll talk about some of the more common ligaments that can be torn at the knee. Joint dislocation, where the joint actually pops out of socket, most commonly in the shoulder that we see in adolescents. And we'll talk a little bit about concussions, which is a hot topic not only in adolescent sports but also in professional sports nowadays. As far as the overuse injuries, shoulder tendonitis, which is fairly common not only in young patients who are throwers and pitchers and adolescents, but also in adults. Achilles tendonitis, which is at the heel. Patellar tendonitis, which is at the knee. Shin splints, which is down the shin bone. And then also patellofemoral pain. And this is just kind of a brief touch upon some of the more common ones. Obviously, there's a lot more than just this. So we'll start with sprains and strains. So a sprain is actually different from a strain. So a sprain is actually stretching or tearing involving a ligament. And a ligament is what connects bone to bone. And you can basically have a sprain in any type of your body wherever a bone is being connected to another bone via a ligament. So that could be in the shoulder, that can be in your elbow, that can be in your wrist, your thumb, your hip, your knee, your ankle. Most commonly we'll see sprains along the ankle though. That's almost invariably the most common area where people will get a sprain is in their ankle. A strain is a little bit different. It's stretching and tearing of tissue, but instead of stretching and tearing a ligament, which connects bone to bone, strains actually involve tearing muscles or tendons. A tendon is what connects muscle to bone. So anytime there's a muscle in the body that's being connected to a bone in that interface, that can be an area where patients can strain that muscle. So the most common type of sprain, is the ankle sprain. You can see in this image here, another word for this is rolling your ankle, commonly seen in basketball players as they're trying to actively move and change direction. Sometimes they'll roll their ankle, and you can see on this slide here, they invert their ankle, and what happens when you invert the ankle like that, the ligaments on the outside of the ankle get stretched out. And so this x-ray, or this bony diagram on the left side of the screen here, shows some of the ankles that can get torn and damaged when you invert the ankle. There's that fibula bone, which this is the outside of the ankle, so there's a fibula bone here. This is the large heel bone here that sits on the bottom of the ankle. And then there's another bone that sits kind of underneath it all in the front. It's called the talus bone. And the most commonly sprained ligaments are the ones that connect the fibula not only to the talus but also to the heel bone there. And so they can get stretched. You can have varying degrees of sprains to the ankle. A low-grade sprain means a little bit of swelling, a little bit of pain. A high-grade sprain is basically where those ligaments totally are disrupted, and sometimes they don't heal appropriately, and sometimes patients will develop persistently unstable ankles that cause problems later on. So common areas of sprain, we talked about the ankle just now, the knee, the wrist, the thumb are also common areas. Usually these fall from, the way these happen are falls. Sometimes it can be a direct contact injury, especially at the knee. If someone gets cut at the knee or being tackled at the knee and their body goes one way and their foot and ankle goes one way, you can have a sprain at the knee. Non-contact pivoting injuries, what does that mean? That means when patients are just running down the field or they try to change direction really fast and pivot, sometimes at the knee, as you can see on this diagram on the right, sometimes the knee can kind of twist and cause a disruption or a sprain to one of the ligaments. If you hyperextend or hyperflex a joint, meaning if the joint goes past where it's supposed to go, that can also stretch out ligaments. So this is a diagram of a knee. There are 4 ligaments that surround the knee. There are 2 ligaments on the side of the knee. This is a right knee looking at it from the front. This is the lateral collateral ligament, the medial collateral ligament on the inside. Those control side-to-side motion in the frontal plane. And then you have 2 crisscrossing ligaments on the inside of the knee, the center of the knee. This is the anterior cruciate ligament right here, And right behind it is the posterior cruciate ligament. And those two ligaments crisscross in the center of the knee, just like that. And they provide stability in the front to back motion so that this tibia does not slip out from underneath that femur as you're walking and as you're doing athletic activities. And you can sprain any one of these ligaments during athletic injuries. And the ACL, as we all know, is a very commonly injured ligament, and if you sprain it badly enough, you can actually tear the ACL ligament, and we'll talk about that a little bit later. So, common symptoms of a sprain: immediate swelling. Patients usually get swelling on the outside of their ankle or in their knee or in their elbow, whatever body part we're talking about. At the ankle, with really high-grade ankle sprains, you can get a significant amount of bruising at the ankle. This is a left ankle. The outside of the ankle is bruised here. You can see there's quite a bit of swelling there. Patients will certainly limp off the field. They'll have pain with ambulation and walking. And so those are kind of the common types of sprains that we'll see. Moving on to strains. What is a strain? A strain, as we said before, involves muscle. So instead of talking about ligaments, which connect bone to bone, now we're talking about muscle injuries. So some of the common strains are some of the large muscles in the leg. Where are those? Those are in the back of the leg, the hamstring muscles, the quadriceps muscle in the front of the thigh there. Oftentimes in football players or hockey players, we'll see groin strains where some of the muscles that attach into the pelvis at the top of the groin there can get pulled. Calf or Achilles strains are fairly common also, and then also rotator cuff strains. The rotator cuff are muscles that surround the ball of the shoulder joint, and just like any other muscle in the body, if you fall on it, if you're doing an aggressive activity, that rotator cuff muscle can also get strained. So symptoms of strains, similar to what we talked about in sprains. This is a leg, this is the thigh, so right at the bottom is the knee. The head and the rest of the body are up there, and the feet are down this way. You can see this is a pretty significant hamstring strain where you see a lot of bruising in the mid-thigh, there's a lot of swelling. Patients often present with, in the acute phase at least, pain to palpation along the muscle belly. With fairly significant ones, sometimes they can actually rupture some of the tendons as well where they attach onto the bone. So, treatment for sprains and strains. How do you treat these? So if someone has a sprain or someone has a strain, what do we do? So the best mnemonic that we have for this is something called RICE. Rest, meaning resting your injury, laying off from sports, laying off from really aggressive physical activity, icing the injured area, applying ice every day for a few hours at a time to help decrease the swelling. Compression around the ankle, compression around the thigh, compression around whatever joint is injured, using compression to help contain some of that inflammation and help with the injury. And then elevation. Elevation certainly helps with a lot of swelling. Certainly with ankle injuries, keeping the ankle and the extremities elevated above the level of your heart will help with swelling. So oftentimes people will say, if you have a sprain or if you have a strain, what are telltale signs that would indicate someone needs to come in to be evaluated or need to be seen? Certainly persistent swelling that doesn't go away, inability to ambulate on an extremity is certainly a reason to come in and to be seen either by an orthopedic surgeon or an urgent care or emergency department. Those types of things are certainly things to be on the lookout for when these things happen. So treatment of the strains. So those are the non-surgical treatment options, which is basically rest, ice, compression, elevation. Low-grade sprains and strains. Maybe patients can take a couple weeks off from sport and get back to things. High-grade sprains and strains can certainly sideline patients up to 6 to 8 weeks until they can kind of get back to what they wanted to do before. In the most severe instances where patients actually tear ligaments or tear muscles, they will require surgery. One of the more common surgeries that we do for ligament tears, at the knee at least, are ACL tears. We'll talk a little bit about that in a second. Hamstring tendon tears up at the top of the pelvis where the tendon actually rips off the bone. Sometimes those need to be reattached onto the bone. Achilles ruptures at the ankle certainly will oftentimes need to have surgery to repair that tendon back to itself so it heals appropriately. And a quadriceps rupture, fairly uncommon in children, but sometimes more common in adults. That's when the quad muscle, the thigh muscle, pulls off the top of your kneecap, and that needs to be surgically reattached to the bone. So ACL tears. One of the most common knee ligament injuries is the ACL, the anterior cruciate ligament. As we talked before, the ACL lives in the center of the knee. It's a very deep ligament inside the knee joint itself. And it provides stability to the knee in a front to back direction. It allows patients to do those aggressive cutting and pivoting maneuvers with basketball and soccer and football to stabilize the knee while they're running and also while they're performing during those very high intense activities. Oftentimes the ACL will occur with non-contact injury. What does that mean? That means patients are just either running down the field, they don't get hit by anyone, they just kind of, their knee twists or their knee gets in the wrong position and they'll rupture, they'll tear the anterior cruciate ligament. The problem with ACL tears is that they don't heal. Since the ACL lives inside the knee joint, it's surrounded by a lot of joint fluid. All that joint fluid contributes to the fact that it doesn't heal well. It doesn't get a good enough blood supply for the two ends of the ligament to come together to heal. The anatomy in girls sometimes makes girls more prone to injury. That's mainly due to a wider pelvis in their stance. And so symptoms of an ACL tear. Patients oftentimes will feel a quote-unquote pop in their knee. They'll feel it kind of something almost giving way or exploding in their knee. They'll have immediate swelling in the knee. When the ligament tears, what happens is the ligament has a lot of blood vessels that go through it. And when the ligament tears, there's a lot of bleeding that occurs. And all that blood inside the joint leads to a fair amount of swelling. Sometimes when they try to get up and moving immediately after the injury, they'll complain of instability. They'll say that their knee is giving out on them or they don't feel confident on their knee. And it can be associated with other ligament injuries. ACL tears oftentimes occur in combination with MCL tears, which is the medial collateral ligament. The lateral collateral ligament can sometimes be associated with it. Patients can have cartilage injuries or meniscus injuries as well. The meniscus is that rubber disc cartilage that sits between the femur and the tibia bone. So the initial treatment after an ACL tear, number one, control swelling and pain. So how do we do that? Same things that we talked about before: rest, ice, compression, and elevation. It's always good to get if there's a concern, especially after an injury and there's a lot of swelling in the knee, to get a medical evaluation is always important. Oftentimes, like we said before, the ACL tear can be combined with other injuries, but it can also be combined with bony injuries, meaning fractures of the bone. So it's always good to diagnose those early on to figure out what the treatment is going to be. So seeking medical attention is certainly really important. Once the diagnosis of an ACL tear is made, usually patients, if they come in to see us in the office, the first thing that we do is, number one, get an x-ray. Make sure the bony anatomy is okay. Make sure nothing's broken. You can't see an ACL, you can't see the meniscus, and you can't see cartilage on an x-ray. And so that's why we get an MRI to confirm our diagnosis of an ACL tear. Once we confirm our diagnosis, most patients are allowed to walk on their leg right after the injury with a brace on to help support them. We only proceed to surgery once the swelling is minimal and patients have regained full range of motion in the knee. So a consultation with an orthopedic surgeon, coming up with a plan to treat the knee and getting them involved in some initial physical therapy to help control the swelling, regain motion, to prepare them for surgery is essential. So how do we fix an ACL tear? Like we said before, the ACL does not like to heal on its own. So unfortunately, left on its own, patients may go on to develop persistent instability, and especially in our younger patient population who wants to be active, who wants to return to their level of sport, those patients are the ones who are most likely to develop persistent instability in the knee, especially with athletic activities. And those are the ones routinely who are getting surgery to have them reconstructed. So there are a couple options. One is to repair the ligament. What does that mean? That means going in and actually fixing the ligament back into the bone with certain techniques. Becoming a little bit more popular. But usually the gold standard for treatment of ACL tears is reconstruction. Reconstruction means taking out the old ligament and using new tissue from somewhere else to create a new ligament to provide stability for the knee. So you might be asking yourself, well, where do we find this new graft? Where do we find this new ligament for the knee? There are a couple options. One is taking tissue from your own body, and then the other is taking tissue from a cadaver, which is an allograft procedure. The majority of our young patients will have tissue harvested from themselves and use that to reconstruct their ligament. There are a few ways that we do that. One is taking your patellar tendon, the tendon that attaches your kneecap to your shin bone, your tibia. We can take out a certain portion of that and use that to reconstruct your ligament. We can take hamstring tendons, which sit behind the knee. We can harvest those hamstring tendons and kind of fashion those into a new ligament. And then a more common technique now is your quadriceps tendon. The quadriceps tendon is the tendon that attaches on the top of the kneecap. So we take out a portion of the quadriceps tendon and use that to reconstruct the ACL ligament. So after surgery, patients are always curious as to what the usual recovery is. So the first 1 to 3 weeks after surgery, most of our patients are able to put full weight on their leg. That all depends on what other type of work that we needed to do in the operating room. Meaning, did we have to repair a meniscus? Did we have to repair any other ligaments? So it all depends on that. The goals are regaining range of motion and controlling swelling in the knee. After that, the 4 to 6 week mark, hopefully patients are walking without any crutches or walking unassisted. We are gradually going to discontinue their protective brace that they had on immediately after surgery. And involved in all this is a very focused physical therapy program. So our patients have a very intimate relationship with their therapists that they're working with throughout this entire process. The 6 to 12 week mark is focused on strengthening. Patients are using a stationary bike. They're feeling pretty good at that point, at the 6 to 12 week mark. 3 to 6 months, they're starting a gentle running program, doing some jumping exercises, plyometric exercises. 6 to 12 month mark is really when we start gradually returning patients back to their sport as their strength improves. Now, every patient is different. Every patient recovers on a different timeline. Obviously, the main goal at the end of ACL reconstruction surgery, especially in our younger patients and our athletes, are to get them back to the previous sport that they were participating in. Usually, that's going to be around 9 to 12 months, and most of the research and the literature out there is saying that we should probably wait closer to the 12-month mark so that that graft can mature, and so we don't put that graft and that reconstruction at risk for tearing again. Moving on from the soft tissue injuries that we just talked about, we're now going to talk a little bit about broken bones and dislocations very briefly. So fractures of the extremity are usually traumatic. It's usually from a direct hit, from football players getting hit on their legs as they're getting tackled. Sometimes you can have stress fractures of the lower extremity. This means overuse injuries of running can sometimes cause small little micro fractures within the tibia or the shin bone, and that's a stress fracture. Oftentimes when patients do present with broken bones and fractures, they will require surgery depending on the location of that fracture. In our younger patients, like we said before, their bones are a little different. They can sometimes experience injuries in different spots. Like we said, the growth plate is one of the weak points of the bone, and sometimes they can fracture through that growth plate and cause separate types of injuries that we don't see in adults. So this is just an X-ray of a tibia fracture in the lower part of the tibia. Those are fixed with this rod that goes down the center, or it's called a nail, that goes down the center of the bone that is affixed with screws at the top and bottom, and allows the bone to heal in the right spot. Dislocations can also occur. The most common dislocation that we'll see in our football players and athletes is a shoulder dislocation. A dislocation is basically literally when the ball will pop out of the socket. They're no longer continuous with one another. So this X-ray on the bottom here is a shoulder that has come out of the socket. You can see this is the ball here. This is the socket here. So this ball is totally not where it's supposed to be, and it's dislocated. Obviously, with any type of dislocation or concern for dislocation on the field, athletic trainers can address these immediately. and then they also need an evaluation, possibly in an emergency department, to rule out anything more serious. The other area that we see a lot of dislocations is the kneecap. The kneecap can come out of the groove of the femur bone. This is an x-ray here where you see a femur bone on the top and a tibia bone on bottom, and then this kneecap is kind of dislocated to the side. This x-ray here is a very severe dislocation of a knee joint where the femur has become disassociated from the shin bone below it. That's actually a very significant injury to the knee joint itself, requires immediate attention and should be treated as soon as possible to prevent any type of further vascular issue in the joint. Concussions are a very hot button issue right now, especially not only in adolescent sports but also in professional sports. So concussions are basically a type of traumatic brain injury that's caused by a bump or blow or jolt to the head. So oftentimes we'll see these in football players as they collide with each other or their head hits the ground. Some of the common symptoms of a concussion include headache or pressure in the head. Patients can experience a varying degree of nausea or vomiting. Sometimes they can experience dizziness, double or blurry vision. Bright lights and noises can sometimes be bothering to them. They'll oftentimes feel sluggish, hazy, foggy, or groggy, and just not feeling right. So the treatment, the important thing about concussions is to seek medical attention immediately. Athletic trainers on the field are very adept at recognizing the symptoms of concussions and making sure that patients get our kids are getting the appropriate care immediately right after they experience this. Especially in the growing child and the growing adult, a concussion can have serious long-term consequences on their future growth and their future itself. So the treatment usually is limiting play, rest, and observation. There's also serial cognitive testing that we can do to follow out how significant the concussion is and how they're recovering from their concussion. We'll move on now to chronic overuse injuries. So overuse injuries are basically injuries that are due to repetitive activities. So throwers, oftentimes throwers who are throwing high velocity pitches over time can develop issues at the shoulder. Some of the more common issues at the shoulder are rotator cuff tendonitis. The rotator cuff, like we talked about, are muscles that sit on the top of the ball of the shoulder, and there's 4 muscles. There's 3 on the top, 1 in the front. And as you rotate and repetitively throw a ball, sometimes those tendons can sometimes get inflamed and irritated. In our younger patients, there's something called a condition called little leaguer's shoulder, which is basically an irritation of the growth plate. This is an X-ray of a adolescent who's a pitcher, and this is the top of their humerus bone here. And you can see here this black line that goes through the top of the humerus bone is actually a growth plate. And with repetitive activities and repetitive throwing activities, sometimes that growth plate can get very irritated and inflamed, and that can cause persistent pain in the shoulder with throwing activities. At the knee, there's something called Osgood-Schlatter, which is basically pain on the shin bone where the patellar tendon attaches, basically growing pains from the growth plate there. Patients can have patellofemoral pain. We'll talk about this in a second. And then also Achilles tendonitis. So shoulder, rotator cuff tendonitis we talked about, little leaguer shoulder symptoms. Usually it's pain with repetitive throwing activities, commonly seen in pitchers. We can even see rotator cuff tendonitis as we get older in our adult population. So the treatment for this is rest, anti-inflammatories, physical therapy, and a gradual return to a throwing program. At the knee, we can see patellofemoral pain. Patellofemoral pain is basically where patients get pain in the front of their knee to a little irritation or inflammation of the cartilage underneath their kneecap. This is a schematic of a knee joint. This is the femur bone on top, tibia bone on bottom, kneecap here. The cartilage underneath the kneecap, as it rides in the groove of the femur, can sometimes get irritated, and sometimes patients can complain of pain with going up and down stairs, pain with rising from a seated position. We talked about Osgood-Schlatter. Osgood-Schlatter is basically a condition that's seen in adolescents who are growing, who are not skeletally mature, which means they have open growth plates. They'll have pain right here where the tendon of the kneecap attaches onto the shin bone. There's a growth plate that sits right there at the top of the tibia bone, and patients will have pain or point tenderness right there. Patellar tendonitis or jumper's knee. This is the patellar tendon. As we're growing, as we said before, as kids, their bones grow faster than sometimes their ligaments and tendons. Sometimes they can get some inflammation. They can get pain right over that tendon itself. Shin splints. Shin splints are basically pain with repetitive use activities and down lower in the tibia bone. And that can cause pain and limit patients from certain activities. It's an inflammation of the soft tissue that overlies the bone, as well as with sometimes muscle involved as well. So symptoms, we talked about those. Treatment for this, for most of these things, is rest, anti-inflammatories, and certainly sometimes a physical therapy program can help. At the ankle, the Achilles tendon, this is a schematic of a foot. This is the heel bone here. This is the calf up here, and the calf muscle attaches to the heel bone through this tendon called the Achilles tendon. With repetitive running or with repetitive activities, you can get a little tendonitis or inflammation of that Achilles tendon. Plantar fasciitis, where there's a band of tissue on the bottom of the foot here, can get inflamed. Certainly, sometimes patients can, with plantar fasciitis, if you're stepping out, the most common symptom is first thing in the morning, that first step in the morning, patients have pain right over their heel bone, which causes significant symptoms. Again, like we talked before, rest, ice, anti-inflammatories, stretching exercises, a formal therapy program can be useful. So what's the cause of overuse injuries? Like we talked about before, sports specialization, which is becoming more and more common in our adolescent population as patients want to become specialized in one sport or want to exceed or excel in only baseball or only football or only soccer. Doing that repetitive sport year-round with the same types of activities, the same types of movements, does put younger patients at risk for overuse injuries. The other thing that's causing patients to have a higher rate of injury risk is limited time off. So patients who train during the summer and also throughout the entire school year. Repetitive stress without recovery. If patients aren't recovering properly and their training schedules are too rigorous, certainly that can also. And there have been studies that have shown that patients, children who specialize in a sport, the earlier they specialize in a sport, the higher the rate of injury that they have is. So injury prevention. I think it's important to understand that children are not just large adults. Children mature and grow at different rates. So not every 14-year-old is going to be the same across the board. Some are going to be more skeletally matured than other 14-year-olds at different times. And all that means is that they can be more prone to injury at certain times in their growth. Pre-participation physical is important, I think. You know, if patients have had injuries in the past, it's always important, or if they've had surgery in the past, certainly getting an evaluation either with your primary care doctor or with an orthopedic sports medicine surgeon in our clinic would be important. Warming up properly before any activity is always a good thing. Hydration is also key in terms of preventing muscle injury, cramping, and stiffness. Ensuring proper training and technique with a good coach. As far as ACL injuries go, hip and core strengthening is important. So talking possibly with a physical therapist if a patient has already torn their ACL and they've recovered from surgery and they want to prevent either a recurrent tear or prevent an injury on the other side, it's important to talk to a physical therapist about that. Increasing training gradually, taking time off, avoiding specialization at a young age. I think all those things will only help patients as they age and grow older and preventing injury. So that's all we had today. Hopefully you learned a little bit about some common sports injuries and how we treat them here at the Orthopedic and Spine Centers of Wisconsin, as well as at Edgerton Hospital. If there's any questions, that's our phone number to reach us for an appointment here. We hope you found this to be useful, and hopefully we can stay active together, okay? Thank you.